Hello, everyone. Heather Holmes here with KTVU Fox 2 News in the San Francisco Bay Area. And once again, I'm joined by Dr. Rashid Chotani, a medical director at IEM and COVID-19 researcher. Doctor, thank you so much for being here.
Thank you, Heather, for having me on the show. And of course, this is a very important topic for you, for me, and the rest of the nation.
Yeah, it certainly is. And we've got a lot to talk about this week. Let's start off with this idea of convalescent plasma. Explain to viewers what it is and how it might help in combating COVID-19.
So convalescent plasma has been used for decades and decades. And basically what you do is you have the blood from somebody who is positive for COVID-19, essentially an individual who's developed long-term antibodies against the disease. And then you extract that blood from that. The individual donates the blood, and then red blood cells and other cells, platelets, and everything is taken out of it. And now you've got plasma, and that plasma contains antibodies against COVID-19. So that plasma then, after matching and all different kinds of things, is given to an individual who is in a hospital setting, an intensive care unit setting, and which of course has antibodies now. So that gives that individual an opportunity to then, the immune system of that individual to actually activate more of the antibodies with the antibodies that are administered to fight the virus itself. It has been used since we started with this pandemic. It's used in a lot of other countries in much bigger and wider capacity than the US. And we've taken a look at it. Scientists have evaluated, if it is going to help decrease mortality or hospital stay. And there seems to be data that suggests that it does it. So there had, in a case like that, from an ethical perspective, when you see a benefit, right, of something, and you have nothing else to play with, you want to use it, and safety is there. And there is certainly a decrease in mortality and decrease in hospital stay. And more studies are needed. But in the meantime, the Food and Drug Administration announced that they're going to give it an emergency authorization use to be used. So now it becomes like an official treatment, which was being done unofficially earlier, also because it saves lives. So it's a good thing. I think it's a very, very good thing to have every little arsenal in the toolbox, or every little tool in the toolbox that we can have against COVID is remarkable. So we've got some, we have some medications that we are using, and now we have this. This is like this is something like a Band-Aid at this particular point till we get more studies done and it's used widely, till we get a vaccine. And that is also coming pretty soon. So I am pretty optimistic as we move forward with all the problems that we are having with COVID, all the problems we'll have with COVID. But science has evolved very, very quickly in terms of providing solutions, trying to provide solutions for this problem.
Yeah, and you mentioned some various therapies, treatments, things like that that are on the horizon. But something else that's getting a lot of attention this week is this Abbott Antigen test. Talk a little bit about what it does, and it's something that a lot of us would be able to do at home.
Yes, and essentially this is a remarkable. We've been waiting for this thing for a while now. So we had the PCR test, which is essentially the gold standard, which actually detects the virus itself. We had the antibody test where we were rapid antibody test where we were doing a finger prick and getting the blood and seeing if you have antibodies, the preliminary antibodies or the big antibodies against the virus. And now we have the antigen test. Now, antigen test is administered in a very simple fashion. You just have to take a swab, and then it's like a small kit, a cassette, and you put that solution that you're getting from either the throat or the nose into that little tiny little well or a hole on that little cassette, and in about 15 minutes you're able to get a result. Whether you're positive or negative for COVID-19, that means it does not pick up. It actually looks for proteins inside the the sample that you're collecting, and that is the way that we are detecting if you have the disease or not. Now, this is it's $5. It's 15 minutes, and you can administer it yourself. Plus, it comes with a complimentary app that now you can download, and then you're able to provide the results to whomever you need to provide it for, so that now if you're positive, you can go in and say that, listen, my test was positive, and then the health department, your healthcare provider, can help you navigate as to where you want to be and how you want to do this thing. Now, again, one caveat. The big caveat with this test is, yes, it's a great test, like antibody tests were, but everything has, it cannot be 100% perfect, right?
Right.
So right now, it seems based upon the researchers that are talking about it, that the false positivity rate of the test is pretty high. The false positivity rate means that you don't have the disease, and the test is telling you that you have the disease. Now, in a home setting, that's not a crisis, because if you don't have symptoms, you're not going to go anywhere.
Right.
But if we do and administer this test in nursing homes, it becomes a problem. Because you are now putting patients who don't have the disease, and if they test positive with this test, you're putting them in the COVID unit. So essentially, you're exposing them to other COVID patients when this individual never had the disease. So PCR still remains the king, in all honesty, and that is still the gold standard. So a lot of healthcare providers and researchers are saying that this is a good screening test, an incredibly good screening test, but it needs to be followed up with a PCR test also.
Yes, but this idea, doctor, that it's easy and it's affordable could be a game changer in what we're doing right now.
It is a game changer. There's absolutely no question about it. This is what we needed. This is what we've been looking for, and this is what we have now. So in that regard, the nation, the science, this is just incredible in terms of moving things forward. Right now, with all the problems with testing, right? We need, supply chain, how we're going to do the testing. Think about Louisiana, Texas, all the hurricanes coming over there. How are people going to go and get tested?
Right.
What are we going to do with our kids who want to go to school? If we have something that we can test on a regular basis, I wish there was a device that was a simpler device, as simple as this, but it was $1, and every household, every individual have it and test every single day as to if they're positive or negative. But we'll get there. I think we'll get there with the volume and all that. The president has already signed off on buying 150 million of these tests at the cost of about $750 million, which is remarkable. We need the 150 million tests, so it's a good thing. I think this is, everything that is positive needs to be appreciated during this time, and how quickly our scientists have really worked and developed these things is just mind-boggling.
Yeah, it is.
Think about this, you think about the vaccine, you think about all the other therapeutics.
Yeah, it is remarkable what we're seeing in the scientific world. Doctor, where do we stand on the testing issues? Can you talk a little bit about your concerns as we continue to fight this fight and the issues that we have with testing?
So the testing has gone down. In your state right now in California, what was recommended and what is being done, let's look at that first. About 62% of what was essentially recommended in terms of testing is being done. But in states like Texas, it's only 28%. And Louisiana, it's 51%. So the numbers are not there. We need anywhere between 1 to 4 million tests done per day. And our numbers had gone up to about a million tests per day, but now they've declined to about 600 to 700,000 tests per day. So the numbers have gone down. There are multiple reasons behind it. First of all, there is individual fatigue, population fatigue. People just don't want to go out and get tested. The second is that we have still a problem with supply chain. And then the problem with the testing capacity, and third is it's just extremely resource intensive, and a lot of these resources are not available right now. So combining all of them together, we've got a problem which is which we're facing. But think about how are you going to, the numbers in Texas and Louisiana are going to go further down in terms of testing, and on top of that, we are opening up schools and businesses and all that. So, and then, you've got about, on Thursday, there were close to 900,000 people that needed shelter. And, how do you provide shelter for all those people? They were without power, completely without power. Whatever number that you have, you've got to provide shelter for these individuals who are in the path of the hurricane or who've been affected by the hurricane. And how do you keep social distancing? So the fear among the scientific community is that because of all of what is going on, the testing is going to go down, and there is going to be a probability, because of this not being able to maintain social distancing during a crisis like this, that the number of cases might increase again. And I hope that doesn't happen. But we know that opening schools and opening businesses, we will see a small number of cases going up. There's no question about it.
Yeah.
Even if you do all kinds of protective measures. But I hope that in those two states, with all of the other things going on, the weather and the climate conditions are not going to just exacerbate what is currently happening over there.
Yeah, and you mentioned what those Gulf states are dealing with. Here in California, we've been struggling with a large number of wildfires that have forced so many people out of their homes and into evacuation centers. Same problem exists there. Social distancing, how do you maintain sanitary conditions when suddenly you're dealing with a lot of people in one space?
Yes, and this has been a very tough year for everyone in the United States. And I can, you think about it. You've got a problem with a disease, a virus that is uncontainable, or we were not able to contain it. Although our numbers are really going down now, and our deaths are also going down, but we were not able to contain it initially. Then you have the race riots going on. And then you have a political campaign going on. On top of that, then you have all these fires and natural disasters happening.
Right.
And hurricanes. We're going to get about 6 more hurricanes by the end of this year. So it's not going to be easy for that region where you're getting all these weather calamities. So all of that is not good. And, this has been a tough year for the United States of America, for everybody.
It certainly
anybody
has.
who's listening, and I can.
Yeah,
And
it certainly has.
The only thing is hang in there. Things will get better. I can guarantee you things will get better with all the testing that is going to be available, the vaccine that is going to be coming out. And by the way, there are a lot of other therapeutics or drugs that are being developed right now that the U.S. Department of Defense is pushing, right? And they are pretty risk averse in terms of coming out and announcing anything early. But I have seen some really remarkable data on some new drugs that are being developed or funded by the U.S. Department of Defense, and I'm pretty hopeful that we will have a few other things in our toolbox soon enough to deal with the problem.
Yeah, that would certainly be good news. We're just about out of time, Doctor. Sort of final thoughts as we get ready to start yet another month amidst this pandemic.
So it's been pretty tough. The world has about 25 million cases with about 840,000 deaths, which is a huge number. United States with 6 million cases approximately, and about 185,000 deaths. And our death toll every day is sadly approximately 1,000 people. It's going down, but it's still 1,000 people. We have not reached where we used to be in terms of our numbers in June. And we are still higher than that, although the numbers are going down, and I hope they go down very quickly. Our death rates are still much higher than what we had in June timeframe. So those are terrible things. We had a second surge, and now what we've learned from the second surge is that we've got to do the social distancing, we've got to still do the masking, we've got to do the hand sanitization, and the young folks in America really need to help out. because it is they who will be able to contain this virus if they observe these boundaries. Till we have something really good, even if we have the vaccine or therapeutics or plasmapheresis or convalescent plasma, we still need to have, we need to be cautious. And let's wait a little bit. And, and in a few months, beginning of next year or middle of next year, we should be able to do almost all the things that we were doing. But let's make sure that we are, be cautious, because remember one thing, in October timeframe, we will still have flu in the community. And if we do not observe the precautions, flu and COVID combined together will cause a serious problem for us. In the Southern Hemisphere, where there is flu right now, because of all the precautions that they're taking, even the flu cases are lower than what they're supposed to be every single year. So if we observe those precautions moving forward, we will have less flu, less COVID, less deaths due to both of them. So let's work together and make this happen.
Yeah, I like your optimistic outlook. Dr. Rashid Chotani, IEM Medical Director and Infectious Disease Expert, thank you so much. Appreciate it.
Always a pleasure to be with you. Thank you.
Thank you.